It is untenable for the head of the Tasmania's Health Service to remain in his position given the government has promised to remove him if it is re-elected, a union says. The Health and Community Service Union, HACSU, said the Tasmanian government's promise to sack David Alcor had created more dysfunction and would be a budget blow. Under the Liberals' health election promise, Dr. Alcor's services will not be required from July 2018. Health Minister Michael Ferguson announced this week that the function of the THS would be stripped back with public hospital managers directly consulting with the health department. The THS was established in 2015 by amalgamating the three Tasmanian health organisations. Dr. Alcor became the head of the THS in February 2016 on a 5-year contract, earning $500,000 a year. HACSU State Secretary Tim Jacobson is concerned about the cost of the change and the price of sacking Dr. Alcor. "This is quite clearly a disaster for the government and it's a waste of more money," he said. "We understand he has 3 years left to go on his contract and we assume there has been some negotiation to his termination." Mr. Jacobson said it was untenable for Dr. Alcor to stay now. There were essentially two structures. The structure that has been put in place now by the minister has been a disaster and has cost the community in many ways, not just financially, he said. "We have the old structure which has essentially now been put in the corner, and that's the governing council and the CEO, while others are now responsible for putting in place a new structure. Given that there are some seriously senior figures involved in this, we think it will lead to further dysfunction and it's not a situation anyone should be in or put in." A government spokesman said the policy would create annual savings of $1 million and the government planned to sit down with Dr. Alcor to discuss his future. In May, the Tasmanian branch of the Australian Medical Association AMA said it had no confidence in the way health system was being managed and Dr. Alcor had not delivered what was needed.